doctor's in, and today we are talking about the latest in skin cancer. Most of us love our Florida lifestyle with the abundance of sun and warm temperatures, but too much of a good thing can do plenty of harm. Dr. Scott Ackerman is one of the First Coast's leading oncologists. He is here today to talk about the most common form of skin cancer. Hey, Dr. Ackerman.
Hello,
Thanks.
Casey.
Appreciate you being here. This is something that a lot of Floridians think about because we just said of all of the sun and the warm temperatures, and you want to get out and enjoy it as much as possible. But when we talk about skin cancer, it's interesting. I mean, you think that there's just one type, but that's just not the case. There are different types of skin cancer.
Correct. So there's three major types of skin cancer. There's basal cell carcinoma, squamous cell carcinoma, and melanoma. Now we put the basal cell and squamous cells together as one group because they behave very similarly. There are little differences between them, but they behave in a similar fashion, and they constitute about 90% of the skin cancers. They grow slowly. They're almost always cured when detected, and when they're detected early, and they're almost always cured when they're treated properly. Now, and we also refer to them as a non-melanomatous skin cancer. So we look at the cancer statistics. We don't even count those skin cancers in general cancer statistics because they're very they don't impact cancer data, cancer survival very much because they're cured in such high numbers. But melanoma, the third kind, malignant melanoma, on the other hand, is much different. It's much more severe. It can spread to other parts of the body. It can cause death, and it does so in many patients. It only constitutes about 10% of skin cancers, but the melanoma and the basal cell and squamous cell carcinomas, they're generally caused by the sun. The sun instigates the growth of these cancers. But the difference in melanoma is that melanoma also has a genetic component to it, and it could be hereditary.
So how do you know if it is hereditary? Because I didn't realize that. How do you know if that runs in your family?
Well, there's certain testings that we could do. We can do testing, a blood test, to determine if you're at high risk for melanoma because of this genetic defect. Believe it or not, about 10% of melanomas are hereditary. And what we find is this genetic mutation called P16, a gene mutation. And if patients with melanoma have that, then it's something that's hereditary.
So how can you identify, because I think this is one thing that a lot of people would like to know, how can you identify if you have skin cancer, any of the three types? Are there any symptoms or signs that you should be on the lookout for?
So you want to first know your skin. You want to know your body. We talk about this with breast cancer. We talk about this with other cancers as well. You want to know your body, know your skin. So when you get out of the shower, take a look once in a while at your body, at your skin, and check any moles or blemishes or irregularities on your skin. And what you're looking for is changes. We all have a mole. I got some beauty mark here and there.
Sure.
But if that changes over time, that's what you want to be alert for. And when I tell my patients who have skin cancer and ask me about other lesions and what to look for, I tell them to remember the A, B, C, D, and E's of skin cancer. And that's very easy to remember, A, B, C, D, E. A stands for asymmetry. If the lesion is asymmetric, if it's not round or oval, but one side looks different than the other, then there's something to worry about. A very symmetrical lesion, low chance of it being cancerous, but when there's asymmetry, it's a higher chance of it being cancerous. B is the borders. Look at the borders of the lesion. Is it smooth all the way around the blemish or smooth all the way around the beauty mark? Mm-hmm. If it is, that's okay. But if those borders are blurry or if they're jagged, then it would be cause for concern that this might be cancerous. Look at the color. C, color of the lesion. If it's nice, uniform color, that's fine. But if the color if it has multiple colors in it, if it's dark in one area, very, very dark in one area, and very light in the other, that may be an indication that it may be malignant. The diameter of the lesion. Typically small little beauty marks like these on my hand are nothing to worry about. But if a lesion is large in diameter, larger than a pencil eraser, that's what a common unit or common thought is, larger than a pencil eraser, then one needs to be concerned that it might be cancerous. And E is not just one E, but two E's. That's why it's the A, B, C, D, and E's. The first E is elevation. If it's smooth, you can't feel it, that's okay. But if it's elevated, that's potentially a problem. And the final E is evolving. If the lesion changes over time, that's why I suggest you look at yourself in the mirror, look at lesions on your arms and on your shoulders periodically, your legs, And if they evolve, if they're changing over time, that would mean that there's a chance it could be cancerous.
Is there anything that you can do to reduce your risk other than, what we typically talk about, you stay out of the sun, as much as possible and wear sunscreen? Is there anything that we can do beyond that?
Right, we talk all the time about wearing a hat and slapping on sunscreen, and those are great. We have to balance that, with we do want to be out in the sun a little bit. We want to get our vitamin D. We talked about that before, about the risk of with association with vitamin D and colon cancer and those things. We want to have vitamin D in our system, but we don't want with the sun. Let me talk about the sun for a second. When you protect yourself from the sun, it's a good thing to do, but the sun exposure for cancers is most problematic when it's a severe sun exposure over a short period of time. People that are out in the sun for a long period of time, for low-level sun exposure, that's not as dangerous as these weekends at the beach where they get red as a lobster. Those patients that we have seen, that those patients are more at risk for cancer than people that work outside and that just get low levels but a lot of sun exposure. But there's some interesting, besides the sun, there's interesting new studies that show that certain drugs and foods can actually lower your skin cancer risk. Believe it or not, coffee. The caffeine in coffee is linked to lowering your risk for basal cell carcinoma. So a cup of coffee a day will help reduce your risk of skin cancer. Also, aspirin has been shown to lower the risk of malignant melanoma. So these studies are encouraging. It's nice, drink a cup of coffee, have an aspirin every day, but still remember, protect yourself from the sun, use sunscreen, use a hat, avoid the sun between 10 a.m. and 3 p.m. and tanning beds. Don't go into tanning beds. Tanning beds increase your risk of squamous cell carcinoma and basal cell carcinoma tremendously. So look at your skin, monitor changes, talk to your doctor about if you have lots of beauty marks or moles. Talk to your doctor about skin mapping, where the physician maps out your body and has a good record of what's where. And anything unusual, a bleeding lesion or something like that, make sure you see your physician and talk to him or her about it.
When in doubt, ask.
Exactly.
All right. Thank you so much. Dr. Ackerman, as always, we appreciate you being here. And Dr. Ackerman is with us every Friday. So remember, if you have any questions regarding anything that we've talked about here today, or if you just have any questions in the top of your mind that you want to ask, you can always go to firstcoastoncology.com and you can confidentially submit your medical questions to Ask the Doctor.